Welcome to the second half of the webinar recording, Perfect Storm or Perfect Opportunity, the convergence of healthcare reform and increased emphasis on quality measurement. This webinar was produced as a service to the community by the PharmaHelps Network, the pharmaceutical industry collaboration for patient engagement. In the interest of making the recording more concise and available on YouTube, we have condensed the content and split it into two sections. This is the second part of the recording. If you have not viewed the first, we recommend you do that before proceeding. We now join the webinar as I ask a new question from the audience. One of the members of the audience would like to know if are there challenges of the changing healthcare delivery environment improving or worsening pharma's access to decision makers? From your perspective, we'll start with Bob this time, Bob Brown. What do you think, Bob?
I think it's a good question. I think it's improving access. And again, I'm a glass half full guy, like Dr. Itis said, but I think because we're all looking for solutions, we're all looking for innovations, we know the challenges, many common challenges we're sharing, I think that, that's an opportunity to open the door and say, pharma's coming in under a little bit different circumstances here. I think the whole pharma role has been changing anyway, as we've seen over the years, but here adds another wrinkle to it. Now we have to partner to really address, again, some of these shared challenges that we all have in terms of health information technology, in terms of patient engagement, cultural competency, quality measurement, achievement, et cetera. So I'd like to think optimistically that it's really improving access ultimately.
Okay. Does anybody else want to comment on that, Dr. Peskin or Dr. Itis?
Well, it certainly changed it. When it's continuing to evolve, and whether or not it's improving or not, or hurting is a glass half full, half empty issue. But when I first went into medicine, the issue with pharma was all based on relationships. We knew the reps. The reps came in, with pre-printed prescriptions. We could tell you the color of the tablets of every medication. There was no formulary. There really was no issue about cost. Patients didn't have pharmaceutical health insurance. There were no PBMs, et cetera. We evolved, and then there was a concentration on the issue of the cost to the patient. So, the big conversations were around coupons that would minimize the cost to the patient. The next wave was we were looking and focusing on drug spends, and so then the issue was, the total cost of the prescription, both to the employer or insurer and the patient. So coupons were less of an issue to discuss with pharma. But now we're really looking at the total cost of caring for a condition or an illness and the total outcomes. And so I think the opportunity is for pharma to come in with better tools to demonstrate what the total cost of care is, which includes hospitalizations, specialist visits, primary care visits, and medications, because that's really where the ball is headed. So I think, it means that there's got to be a completely different level of conversation and of skills of the pharmaceutical rep to be able to discuss that with us.
I think just to build on that different conversation, I would say that both NPP, non-personal promotion, and PP, personal promotion, are on the decline in the traditional sense of the physician medical practice, and that the conversation is a different conversation, and also with different people. It's with the medical director or lead physician of a like Bob, a president of a group, and so it may not have access to the individually practicing physicians. Certainly, a lot of the IDNs and academic health centers and group practices don't allow any kind of routine conversation to go on Other practices I visit around the state still have a lunch and learn every day in the break room. So there is a variability. Overall, I'd say the conversation is changing, and who you're having the conversation with is changing. It may only be a few of the physician leaders in a group that are really kind of looking at population health management and as Bob said, total cost of care for your hypertensives, for your diabetics, for your asthmatics, for your rheumatoid arthritis patients, and so on.
Okay.
And I think even that can be viewed positively because think about the pharma companies themselves are cutting back, right? They're trimming their sales forces, they're guarding their resources more closely and more limited resources as well in some cases. But if it's a situation where I as a rep can come in and sell to many by selling to one, to that key decision maker who may be a little bit higher up the chain, then that may bring some added efficiencies to my process as well.
Absolutely. So we can take one more question from the audience, and we've got one here that says, how can practices and pharma companies work together to make greater use of social media? And we, on the pharma side, we're interested, I guess, because it says without compromising regulatory compliance, which is always a problem for us in social media. Dr. Itis, do you see any way that pharma companies could work with your practice and do something in a social media sense that might be in the
graduation?
Boy, I'm not an expert in social media, but I do know that patients with illnesses like to network with other people that have the same problem. So, I hear people go on, for example, patients like me. Mm-hmm. I think that if you had a patient with an unusual condition and they could, network with other people that have that condition, that's useful. Now, the challenge there is the confidentiality issue. When consumers are talking to each other over social media, that's fine. That's a free-for-all. But, if we were involved as providers or if pharma was involved, I think that there's, first of all, I'm not sure that patients would really warm to that. I'd have to think about that. Secondly, I think that we would be a little bit nervous about the confidentiality issues.
Mm-hmm. That makes sense. Dr. Peskin, do you have any input from a payer side?
Well, I wouldn't say that Horizon is at the leading edge in terms of baking social media into how we have conversations with and propel our patient engagement. But it's certainly in the mix. Again, recognizing that these are relatively low cost, albeit fraught with things around privacy and appropriateness and all of that. So it's definitely in our construct as we look at going from more of a wholesale to more of a retail model of healthcare, as evidenced by us opening up our first retail store in New Jersey, which I think Florida Blue has around 14 now. It's just an example as individuals come on to exchanges and make individual decisions, and some employers will dump their benefit plans as is expected in 2015 and push their patients toward individual choice with a certain amount of money. So we're definitely aware that we need to evolve, and social media will be one part of that.
Okay, great. Bob, do you have any closing comments? Because we're coming up on our hard stop at 1:15.
Yeah, I think there's a lot more to talk about here, and I think that question about social media just opens up another door about issues that we have to wrestle with because our patients have already embraced social media clearly, And, as society at large, and I think we're seeing nothing but continued growth in that area. So we've been kind of tiptoeing around it now for a number of years in pharma, trying to get a hold of the regulatory issues, et cetera, and I think we're still not there. I think we're still wrestling with it, and I think we have to come to grips with that. And it's an issue I'd like to discuss more with Drs. Itis and Peskin and with you, Steve Casey, as well, moving forward, among a number of other issues as well. But this has been very helpful and very enlightening, and I still feel optimistic and glass half full that this is an opportunity more than a perfect storm, but I think there's still much to think about and discuss on these issues.
Great. And I want to thank the panel for their time. We really appreciate you coming on board and discussing these issues with us and helping some of us in pharma understand a little bit better what's going on and how we might be able to participate in it. Dr. Peskin, Dr. Itis, Bob, and for myself, thank you to all the attendees. And just leave you with one last thing, which is an ad for PharmaHelps Network. So if you have any questions about PharmaHelps Network, be sure to contact me. You have my email address, and you can also reach me through contact@medadvocacy.com. Thank you very much, everybody, for attending. And